Kia ora. Welcome to this session, and we're looking at the 2023 iteration of the final examinations for the cardiology paper. So there are 3 exams, 2 of which are multi-choice exams. Just to break up the amount of reading that you have to do to get through some of the questions, we've broken it into 2 separate exams. So you can do these 2 multi-choice exams in any order you like, but just make sure that you've completed one before you attempt to open the other. Once you've exited one exam, there's no going back to it. So the third exam is the ECG exam, and that's the one that has the 3 ECGs that need a full analysis and interpretation using the 10-step template that we've been using all semester. So some advice around the multi-choice exams. Firstly is that we've included quite a few graphics to help out, and this might include shots of ECGs or excerpts of rhythms. Now, we're not asking you to do either full 5-step or 10-step analysis on this. If you do, you're probably going to run out of time. So we have identified the issue for you. So we might point out something in the question that requires you to respond to that very specific part of the ECG. The other thing about the multi-choice is that there are also multiple answer type questions in here, and you'll recognise these because we've identified how many answers are required. So the first exam, part A of the multi-choice, covers 3 areas. The treatment section has 12 questions, and what they are is 3 scenarios. Each has its own multi-choice questions associated with it. So we've broken up the pages. There's 1 page per scenario. The answers are aligned with the New Zealand CPG and best practice, but whichever version of the CPG you're using should be sufficient. What we're going to be asking you to do in these are to select the appropriate treatment. The scenarios can be a little dynamic, so there can be some changes in vital signs that then require you to make another response in a different question. We'll be asking you to identify from lists what the priority actions are that have to be undertaken, if there's any exclusions to treatments, and maybe to manage something around contraindications. The electrophysiology section is quite short. There's 5 multiple choice questions, and they're all based on what would be normal findings in terms of electrophysiological indications or principles. So these questions could be based around lead placement, the nature of conduction pathways, or other things that relate to ECG morphology. The pathophysiology section is a bit longer. There's 23 questions here, and what we're asking you to do is to identify features of either symptoms or ECG changes related to acute myocardial infarctions, other ischemic conditions, or structural heart disease such as failure or hypertrophy. Amongst the questions, there's going to be some that are purely related to conduction problems. So this could be anything from bundle branch blocks to other forms of block. And the other area that we're going to be exploring in pathophysiology is symptom association. So we might identify a symptom and ask you to identify what condition it's most likely to be associated with, or we might do the reverse. Part B of the exam also has 3 sections. It has a pharmacology section, a section that's entirely rhythm recognition, and another one is more about interpretation. So the pharmacology section, 10 questions. It'll examine drugs that are used as antiarrhythmics. It might examine drugs that are used in the thrombolytic suite. And it's going to ask very specific questions around drugs related to their indication, their action, so that would be their pharmacodynamics, or information around or contraindications or adverse reactions. So this brings us to the interpretation section with its 22 questions. Now here we're going to be asking you to identify features of supraventricular rhythm. So 5 questions related to that. So it might not be a full analysis of a rhythm. It might be a very focused look at an aspect of a rhythm that identifies it as being supraventricular or not. Similarly, there's going to be 8 questions that relate to the features of ischemia, infarction, and mimics, and 5 more questions that will be features of ventricular abnormalities. So this may again be related to rhythm or conduction problems. And there are 4 questions that are very specific to the features of conduction blocks. So this brings us to the rhythm recognition section, where you'll face 8 questions, each of which has a rhythm strip. There's no focused information to help identify what's going on here. You're expected to do the 5-step analysis or its equivalent, and to identify the correct answer from a list of viable options. So this brings us to the last, or the third section of the exam. Now, again, it doesn't matter which order you've done these things in. You can do the ECG exam before the multi-choice if you prefer, or afterwards. But remember, once you've entered an exam, you only get one shot, so you've got to complete the exam. We're given 45 minutes, so that's sort of an approximation of 15 minutes for each of the ECGs, and we've provided a templated answer. So the template that you're already familiar with, so this is the full version with all the clues in it, but in the exam you'll just get a blank version that shows all the headings down the left-hand side of the template, and you fill in the information for the right side. And as per our previous discussion, remember the marking for this is that the marks are split 50-50 between the interpretation and the data mining. So there's 5 marks available for working out things like the regularity, the rate, the axis, features of the P wave, the PRI, and these features of the QRS complex. Remember, never undersell yourself on these. What's going on with the ST segment and the T wave. And then the remainder of the marks, the other 5 marks, will be around interpretation and recognition of the pathology that's associated with any ECG changes. And I'll just come back to the QRS complex. Remember, we might look at this in one of 3 ways. If it's a narrow complex QRS and there is no glaring abnormalities, there's 4 steps that we're going to go through. One's to measure its duration. The next is to look for the presence or the absence of Q waves, what the R wave progression looks like, and whether there's any other abnormalities. And the example I've given there is a tall R wave in V1. However, if the QRS comes up as wide, so you've done your measurement and it exceeds at 0.12 milliseconds, then there would be some alteration to how we might go around working out the information that's required for this part of the template. And what we're essentially looking at, if it is a wide QRS and there is a supraventricular origin associated with it, then we'll be using leads V1, 1 and V6 to work out what sort of bundle branch block is occurring there. And if it's a left bundle branch block, we will be then using the Scar-Boser criteria. And if we've got tall or large amplitude QRSs, the other thing that we might be looking for is the signs associated with ventricular hypertrophy. The other time that we would be looking for the signs of ventricular hypertrophy is when the clinical information coming with the question is highly suggestive that this is going to be part of the problem. So that's enough of a rant about the exam. If you've got any questions or want to know anything about exam support, please give me a call. In the meantime, ka kite.